there's some new data on coffee and liver cancer. Should coffee still be considered good for us? Yes. We knew it decreased our risk of diabetes, and there's new evidence to support that, but what we didn't know until last year is that it protects us from liver cancer as well, protects us from brain cancer, and protects us from death, decreased all-cause mortality. This shouldn't be a surprise. What is coffee but beans and water? It's a plant food. You know how soybeans have those healthy phytoestrogens? Well, now we know so does coffee. The reason I do not recommend drinking coffee is that there is something even healthier to drink instead, and that's tea. Coffee is beans in water, tea is dark green leafies in water, and though both are healthy, certainly, greens beat out beans. And one of the reasons it's so difficult to study the relationship between diet and cancer is because many dietary behaviors are associated with non-dietary behaviors. For example, the reason we used to think coffee drinking caused cancer was because people who drink coffee are more likely to have a cigarette in the other hand. When you factor that out, though, for example by looking at just non-smokers who do or don't drink coffee, we find that, if anything, coffee consumption may reduce the total cancer incidence. Not by much, but overall, according to the latest review, an increase in consumption of 1 cup of coffee per day was associated with about a 3% reduced risk of cancers, especially bladder cancer, breast cancer, mouth, colorectal, endometrial, esophageal, liver, leukemic, pancreatic, and prostate cancers. Coffee beans aren't really beans, but one is, after all, just soaking a powdered seed in some water, so a reduction in cancer risk? Not that surprising.